Good afternoon. Estimates suggest that nationwide between 15 million and 18 million people are at risk of losing their health care coverage. Why? In 2020, so 3 years ago, the federal government declared a public health emergency, which we all know was COVID-19. And folks who qualified for health care coverage through their state's Medicaid program, in Missouri, it's Missouri Health Net, they were able to keep their coverage, and under most circumstances, and participants were not required to complete their annual renewal during this time. Now that the public health emergency is officially over, participants are required to complete an annual renewal through Missouri Health Net to make sure that they still qualify for help. So you may have never had to do a review of your Medicaid status or the Missouri Health Net status for people in Missouri. And now you are going to be required to do that. But not everyone will be sent their renewals all at once. Your renewal form will be mailed to you between April 2023, which is right now, and April 2024. Most states, they have between 12 and 18 months that they're going to stagger out these notices. So if you had a renewal in the month of, say, September previously, that's going to start back in September. If you've never done a renewal, you're going to need to make sure that you understand when that's going to be required. Missouri residents, you can go to mydss.mo.gov and enter your date of birth and your social security number or your DCN number. So that's mydss.mo.gov. It's important to understand that some participants with both Medicare and Medicaid may be directly impacted on their Medicare health plan if their Medicaid status changes. Okay, so this is really important. If your Medicaid status changes, you may no longer be qualified for some of the plans that maybe you have, or a plan that you've been enrolled in due to your Medicaid status. If a Medicare beneficiary experiences a change in the Medicaid status, we suggest they immediately review your health plan to make sure that there's not an interruption in coverage. If you are on Medicaid and not on Medicare, and you have a review coming up and you no longer qualify, this also allows you to have a special enrollment period to move on to a plan and potentially get a tax credit. So these are important things that you need to understand. If you no longer qualify, you'll want to explore your options because this does allow the special enrollment period to pick up coverage and avoid the lapse in coverage. If you've moved in the past 3 years, make sure you update your information by reporting the change. Again, you can go to mydss.mo.gov or call your local Medicaid or Missouri Health Net office. You can also reach out to our office for more information and guidance regarding these changes. Our phone number is 573-693-9443. We can review what your benefits are. We can help you understand what your choices are and what you have coming up, deadlines, things like that. We will look over any letters or anything that you've received and you're not clear on and you don't understand. So please be sure to give us a call and let Jennings Insurance Group help you. We have multiple agents here at any given time to answer your questions. So again, call us at 573-693-9443. I hope you're having a great week.